Welcome back, everybody. I am so excited to have my online friend who I'm meeting in person or almost in person for the first time here, CJ Spotswood. Hi, CJ. Thank you so much for being with us.
Hi, Beth. Thanks for having me.
So I've been following CJ for a few years now. He is known as the Entheo nurse on the internet, and we just became friends. And then I heard about his book, and then I was like, okay, you have to come on the podcast. So let me tell you a little bit about CJ. CJ has 10,000 degrees, no, MSN, APRN, PMHNP-BC, and he'll explain that in a minute. Also known as the Entheo nurse. He is a board certified psychiatric mental health nurse practitioner with a practice in central Maine. CJ is a third generation male nurse and has over 20 years of psychiatric nursing experience. CJ recently graduated from the University of Southern Maine, completing his psychiatric mental health nurse practitioner degree. And CJ's undergraduate nursing degree was from the University of Maine at Augusta, one of 15 nursing schools endorsed as a holistic school of nursing. This curriculum included yoga, Reiki, and various complementary and alternative modalities. CJ is currently enrolled at CIIS for their psychedelic assisted therapies and research certificate program. CJ has been researching and teaching on psychedelics since 2018, which include having twice presented at the American Psychiatric Nurse Association's National Conference on Psychedelics in Psychiatry, an educator for Psychedelics Today, co-authored Psychedelic Support's continuing education module on psilocybin, and is a past presenter at the Mount Tam Psilocybin Summit. CJ is the author of the new book that has just come out, The Microdosing Guidebook, a step-by-step manual to improve your physical and mental health through psychedelic medicine, which is available through Ulysses Press. CJ is a member of Open Nurse, Organization of Psychedelic and Entheogenic Nurses, the Psychedelic Medicine Association, and the American Psychiatric Nurse Association. When he's not working, reading, or writing, he can be found spending time with his wife, Megan, and his daughter, Mallory, exploring Maine's outdoors and craft breweries. I love Maine. So CJ, you do have a lot of degrees, a lot of studies. You just informed me that you wrote a book while finishing up your thesis. I find that to be absolutely incredible and slightly insane. That's a lot of work. So I'm curious to hear your story. How did you get onto this path of being the entheo nurse, going into psychiatric nursing and then mixing in psychedelics? We love to hear your journey.
Oh, well, to start, I guess I graduated high school with my LPN nursing degree. I did my junior and senior year of high school. I took, I was in, was it like craft trade school where I just went half time doing that. My dad was a nurse and my grandfather was a nurse, both
Mm.
psychiatric nurses. So I was like, I might as well try it while I'm in school, spend half the day not taking high school classes, see where it goes. I enjoyed it. And I kind of went back to school, got my associate's degree, wasn't done, went back and got my first bachelor's degree in psychology, joined a fraternity, went back and like partied it up because you can't really party up too much when you're in nursing school. And then went out and travel nurse, which brought me to Maine. I'm originally from northern New York, northern New York, up by the Canadian border, and came here, like fell in love with the area. It's just a great place. As a travel nurse, and I decided to settle down and just live here. I went back at one point and decided I was going to get my bachelor's degree, which was at the University of Maine, not knowing what their program was. It was kind of like, as I jumped into it, I found out from it was a holistic school of nursing. And I didn't really realize what it was and what it was going to be. And how special it was. Here I'm taking classes on Reiki and yoga for nurses, and just kind of like, here at this point, I had like 15 years of nursing, and it's all been psych. And like everyone in my class was like doing stuff, and they're talking about like their medicine and their ICU experiences and things like that. And I was just kind of like, well, let's treat the psych piece. Let's not forget about the psych piece. Not thinking about this is like what nursing is. The art of nursing is mind, body, spirit, the whole thing, and not just medicalizing one thing. So it was just normal for me at that point just to kind of do that, stick with it. And when I finished that, I went back for my psych nurse practitioner. Um, and didn't realize at the time, but my mentor for my undergrad, she was kind of a hippie nurse at the time, and I didn't find out till much after she had actually written the handbook "Cannabis for Nurses" that came out last year, which is an amazing book. Dr. Carrie Clark. So it's a book on nursing and bringing in cannabis, and she was the former president of the American Cannabis Nurse Association. So I kind of saw like here you can kind of do different things with nursing and kind of go off the beaten path. And I was like, okay, this is kind of cool. Not thinking anything of it. Um, but I was in grad school. I had a patient come in at one point um, who had his first psychotic break in his late 50s, which is kind of outside of the norm of when you'd see it. No history of substance use. Worked him up completely medically. Started treating him, and a couple days later, he was still in my care. And he had, as he was less psychotic and came out of it, he was telling me that he was trying to self medicate for his depression. Um, with penis envy mushrooms, which went to, okay, let me learn about this. And this was before Michael Pollan's book came out. It was about 6 months before that. So I started looking up penis envy mushrooms, which I'm guessing here I was every day worrying about, IT coming down and auditing my what I'm looking up at work on the computer, going, why are you looking this up? Um, but I end up going down the rabbit hole of that, and Dr. Stephen Pollack that came out in the 70s, his studies with mycology and how he was murdered at one point. There's a great write up about him that Hamilton Morris had done, and I can't remember the magazine. It was Death Spore, I believe it was called. So it was really kind of like going down that rabbit hole and learning about that. And then Michael Pollan's book came out, and I was just like, okay, there's something to this. And I dug into a lot of the old research at that point from the 50s and 60s, and really started getting excited and just learning about it. And then when I had a project for school, I had started pulling some stuff together. I had to do a research project basically for grad school. And I was like, I'm going to look at it and do more into the psychedelic piece. And I threw in an abstract about psychedelics in medicine for the American Psychiatric Nurses Association. And I was picked. I was end up picked for a presentation. It was the in for the at the national conference. I'm like, what am I going to be expecting? What's going on here? And when they do the conferences, they have pharmacology hours for advanced practice, and you have to have so many of them every year. So when people go to conferences and they're harder to get to for those specific hours, they're heavily attended. So here I walk into this conference not knowing what I'm going to expect, and I had like 500 people there, like standing room only, literally horseshoe around, like there was no one in there. And it was kind of funny because I was sitting in there in the talk, and the talk before me was a talk about S-ketamine, and a couple of the people sitting in front of me were like, well, I hope the next talk's not going to be so dry. That was kind of boring. And I'm sitting there, and I got up to the podium, and my wife was sitting there, and she overheard them, and they go, holy crap, that's the guy that was just sitting there. So, and the conference went amazing. The talk went great, and it was like well engaged, and it was like I didn't expect that. I didn't know what to go into, thinking I'm going to talk pro drugs, kind of. And it was well accepted. People loved it. And the rest of the conference, people were coming up going, hey, you're the mushroom guy. I remember being on mushrooms before. A couple of people who had been in studies and done research back in the 70s before it was illegal. I met some people doing that. And I was like, I'm onto something here. Like this is huge. So I started like putting in some more abstracts and doing some more education on it. Um, and then fast forward a couple of years later, I ended up had a call from someone I'd done a conference with from Dan from the psilocybin summit, who had asked me. He's like, "Hey, I've got a friend who's looking at doing some information on microdosing. She keeps getting all these questions. Would you be willing to talk to her about it?" So I her name's Tara Lee Weathers. I'd talked to her, and she's like, I've got this project I'm working on, but people keep asking about drug on drug interactions. Can I give this? Can I do that? And all these medical questions. She goes, I'm way over my head. I'm a coach, but I can't do this. Would you want to jump into this project with me? And I was like, okay, I'm interested, but I was kind of skeptical initially with the whole microdosing and what I was going to kind of look at. So I started getting into the coaching. I started putting together a handbook for it. And at one point, for my own protection, I kind of was like, you know, I'm not giving any medical advice, but if you here's all this information in this handbook, bring this to your medical provider, talk to them, give them some information, and if they have any questions, I want to have it all here. And at that point, it kind of dawned on me. I'm like, holy crap, this is bigger than what I'm expecting. This is more than a handbook. Like providers could have this on their desk. If I was doing this, I would want to have something like this to provide for my patients to give them information. And at that point, I just started kind of pitching some ideas to some publishers and coming up with some ideas. And I, Michelle Janikian from the psilocybin guidebook handbook, I talked to her and I got on with her publisher, Ulysses Press, who were like, "Yeah, we're open to this because it's not that weird to us. Let's go with it." So it just kind of things fell in place, absolutely amazing for me, one after another, and it just kind of ran from there.
Amazing.
Does
I
that
love
answer your
these
question?
stories. Yes.
Good.
And I'm still like, excuse me, I'm still blown away by the amount of studies and, training you've had in all these realms. I mean, it's just
Yeah.
incredible that you were able to do all this and publish a book and put this all together. Now, I'm curious, when was your first, psychedelic experience, and did that shape anything you've put out there?
Uh,
Like, or how did it shape your life?
Really, it was there's the piece with like in Michael Pollan's book where he's talking about like recreational, what's this
Yeah.
and that. Um, of course, I had some experiences early on, but nothing that was like earth shattering, kind of like therapeutic, looking at big deal with it. And I was also on the other end where I was always seeing people at their worst times. They're coming into my emergency department, you know, not doing well. So it was kind of like, if this is therapeutic, we need to make this safer. And that really kind of balanced me to kind of be more approach to it as, we want to safeguard, come up with some plans. But when I was in between doing around the time of my presentation and kind of working on some other things, I had a really great experience where I ended up eating some mushrooms, went for a hike on an island nearby. And when I did that, it was kind of like it was it really set things in place. And as I'm coming down and walking, that's where I kind of came up with the idea of the entheo nurse and was kind of like, okay, the healing from within and entheogen and nurse is what I am. And it really just made sense with my holistic background. Like, these substances can be used as a scalpel to kind of get in other places in our mind to make the transformative changes. And I was like, this is what it's meant to be. This is what I need to really start focusing on. And really just, it just self assured me like more than anything.
Mm. Oh, I love that. Oh, I love that. I love how it's like these little tiny golden nuggets throughout your
Mm.
path and your journey. So let's hear about your microdosing guidebook, and then we'll go into some specific questions I have
Yeah.
around microdosing. Microdosing is a huge conversation because it's so much more accessible to people that maybe
Mm.
aren't ready for a 5 gram dose, or
Mhm.
even something relatively smaller on like the 2 gram side. But what is the microdosing guidebook all about, and who is it for? Is it for, doctors and nurses, or is it for the everyday person like me who just wants to understand microdosing and how it works? Can you tell us a little about that?
It's yes and yes. It's both. Um, I put it together. The initial piece of for the average person coming in as a handbook. Like, I want to know more about this. Where do I go? And a lot of the information in the initial parts of the book is not anything that's earth shattering that people can't get anywhere else per se, but it's not easily accessible. Like, Fadiman's open work that he did in his research without having without an institution, it's out there, but you have to kind of dig through it. You need to kind of go onto his website and look where you're going and listen to his other talks. It's all there, and I thanked Jim for his work. Um, and actually, it was nice when I'd sent him like the initial draft. I said, "Hey Jim, I'm looking at doing some work here. This is what I'm doing," and I kind of got his blessing from it. And he like sends me back a message after he read it. He goes, "I love it. It looks great." He goes, just the research is kind of looks like for more of the when it comes to LSD, kind of dialing it down to more 7 to 13 mics more than anything else. He goes, there's other people that will tell you it's more than that, but this is based on my couple of thousand reports I've done. And it was just like, thank you, Jim. Like that okay, I'm in the right path and I have your blessing. That's great. Huge. Awesome. So it's kind of built for the people that really don't know what to do, where to go, and just like the absolute beginner, like what is a mushroom? How do I end up going from it? How do I measure it? Kind of the science of it. Um, and it really goes through like I go through more of the Fadiman protocol just so someone can kind of get a relationship. I do explain a little bit of the Stamets protocols and the other ways of going, but I really like the Fadiman so people can have that relationship and looking at what the medicine's actually doing as opposed to just dosing every day like any other standard medication that I prescribe people. So it really builds up that relationship and kind of knowing and slowly dosing up and getting an idea. Um, and it really I go through how to like prepare it and how to make it into capsules, etc. But also how to manage specific side effects like GI upset, sleep upset, things like that of complications. So if people are experiencing it, it's not like throwing it all out. Okay, how can I make this a little bit more easy for me? And then the second half of the book is for providers. I went through and kind of went through a deep dive of all of the psychedelic research I could find of drug on drug interactions. Um, since there's not anything really out there specifically of drug on drug interactions when it comes to microdosing, I kind of went, here's what it is for macro dosing. Here's what the research is actually here. Here's what kind of people might say. But I also took it one step further and kind of dug into like the specific like nuances of, well, if this is the receptor it's going to, this is the receptor that the microdosing is working on, where you might have some potential like drug on drug interactions, but also kind of like looking at specific like uh, off-label use. Like sometimes providers like myself might use antipsychotics for anxiety or sleep or something. So specifically looking at the drugs and why it's important to know it's not just a sleep medication, it's this type of medication, what it is, and where the conversation is. I really went heavy on that second half of the book with citations, so that way providers can go, where the hell are you getting this from? And I had spoken with a couple of other people, like Ben Malcolm, the spirit pharmacist, went with some of his research and kind of talked to him and bounced some ideas off of him to really, I mean, he is the guy for anyone looking on drug interactions. So I really did a lot of his stuff, but I pulled it all together for it really easy. The other part in the I forgot to mention in the beginning half of the book was also kind of what are some conditions that we might be looking at treating, either psychological or physical conditions, and theoretically why it might work for microdosing, what might be different. But I also went into like the research on microdosing and talking about you know, is it a placebo, and kind of like differentiating all of that, which is another conversation we can talk deeper at the end, which I'm sure now I'm seeing you might be interested in that. Um, so I really broke it down like all of that. And then the last third of the book is a week by week playbook, kind of like here's a week and looking at like the biopsychosocial model. What do you have that's affecting your life biologically? What's in your life physiologically? All of those types of things to kind of really, as we're doing these changes, like we need to, when it comes to any medication for any psychiatric condition, the gold standard is pharmacological methods, but also doing therapy. So I kind of went, okay, if someone's not going to be able to go to therapy, here's a little bit of like cognitive behavioral restructuring types of things to kind of really take into consideration and think about it to as they're going, and it builds up week to week to week as you go to really get you thinking outside of your head and where you are outside in the rest of the world. So it really,
Mm.
and I also there was a great part that my partner there, Tara Lee, in our project, really went into like a mixtape where we pull in music and kind of like coming up with songs to kind of really do with it, which is really a fun aspect too. To kind of like you can actually do it, and when you're not, if you're listening to music that ties into that, it brings you back to that place, and it kind of really it the program it's like a guidebook but also kind of a program that really does a lot of different things for people instead of just dose and go like standard medications are, unfortunately.
Yeah. This is amazing. This is a sounds like a very comprehensive guidebook. Amazing.
Yeah.
Because yeah, I mean, even me as someone who's experimented with microdosing for many years, kind of I'm one of those people where it's like, okay, I just feel into it. Sometimes I
Hmm.
want it and sometimes I don't. There is no I don't follow a protocol. I have, one tincture I've been working with for a while. But I've done enough research to understand the very basics, but not to this depth. And now, what I'm wondering is with someone with your background in psychiatric nursing, I'm curious what you feel the potential that microdosing really has in our world, like could be. Like, do
Hmm.
you feel that this might replace something in the current model of, masking with, an antidepressant or antipsychotic? Or do you think it's going to be complementary? How do we see microdosing really fitting into our healthcare system, psychiatric system, and our society? I'm curious what your thoughts are on that.
I'm glad you asked that because it's really a different question than what I've been ever been asked
Mm.
anywhere. Um, because I mean, my role now, I've been a psychiatric nurse practitioner for a little over a year now, where I have a patient profile of around 200 patients I see regularly now. Um,
Wow.
and I prescribe them medication, but kind of like a lot of the conversation I have is, I can prescribe you a medication to, do this, do that, help with sleep, lift your mood, but it's not going to change a lot. Like, it's not going to change. Um, if you're not having healthy lifestyle things going on. And that's where the other part I explained at the beginning of the book is kind of like the biopsycho spiritual model. But I also talk about like the four food groups of good mental health, you know, and medications can't change that, be it diet, exercise, sleep, stress, anxiety, things like that. Like you really, a drug isn't going to change that. Yes, a medication might help you with, sleep if someone has a problem with getting sleep, but you need to get sleep regardless. Pumping up on caffeine is not going to change that, or exercise. And they're all interconnected, they're all affected. And one of the other parts of like diet, like, we have to look at the other part of diet is not just what we physically eat and consume, but the other things, loud noises around us, social media, negativity, things like that. We're still consuming that. We're taking it into because the Greek Latin base of that for dieta, which dieta, when like if you think of someone who's doing like ayahuasca dieta, is all of those things that we're consuming and the things that we're taking in, and they affect us in many different ways. Being on a computer with a blue light as you're sitting there late in the evening is problematic. And these are conversations I have with my patients all the time. So we need to take into consideration those pieces before everything else. But when it comes to microdosing, you'd mentioned about microdosing here and there when you want to. I think that's the kind of the goal is I feel for a lot of people, and I've had some really good luck with patients who have told me that they've done it. And in going through the 6 or 8 week microdosing journey, figuring out what your dosage is and where you're at and what you need, also you can kind of build up a relationship where You might dose once every other week, once a month, every couple of weeks when you feel like you need it, or when you're getting ready to do something special, like go out and to be more social or less anxious or whatever. So if you have that relationship with the medicine and you can kind of do that, it can be completely changing. Um, because these medications, these medicines can do differently by growing how the connections in our brain are and kind of changing everything else. So I think that's where it's really going to be different, um, and more of a not just a holistic approach, but a completely paradigm shift with these medicines. And that's where I'm excited to see it, instead of just taking a drug and hoping that everything's going to get fixed and then get mad at me because the medication I prescribe is not changing anything when, you know, it's the environment, it's the everything else that they're doing that, they're not modifying.
Perfect. Perfect answer. And yeah, I'm one of these people where it's like, well, I'm not struggling with depression. I'm not really struggling with anything in particular. I just feel into, oh, today would be a nice day, or I'm about to do something creative, or yeah, like enjoy dancing or a hike, or, things that just kind of, adds a little enhancement.
Yeah.
But it's been interesting because, I have a community, I have a Facebook group, and we see people asking these kind of questions all the time, like, can I microdose with this? Or my doctor gave me that, or I'm coming off of this antidepressant, or,
Hmm.
like literally, I now can just send them your guidebook and say, hey, buy this, like,
I,
check this out. But, I also want to ask about something you mentioned that I've actually heard almost no one mention except one of my body workers mentioned this a few years ago, about microdosing for physical, like for
mm,
the physical. Um, my body worker, who also works with medicines here and there, had mentioned something about, the science behind the mushrooms. And, I don't, it's like he mentioned it just kind of in passing about like
yeah.
reconnecting the nerves and And when I'm working on, like, because he sometimes will do his body work with low dose
Mhm.
mushrooms. And I'm like, oh, I never thought of that. Is there a science behind microdosing and healing physical ailments in the body? Like, is that a possibility?
The short answer is I believe so.
Hmm.
The long answer is, when it comes to the challenge when it comes to microdosing research is there just isn't any. There just isn't
Hmm.
a lot out there. But if you look at some of the research and you start going into either the new stuff or the old stuff, and I cite it throughout the book, is if you look at, like, we know that there is um, a response at these low doses. When you look at the early research that was conducted in the 50s and 60s, and a lot of it was with LSD, when it was able to be done, the zero doses were sometimes low, what we would consider microdosing now, and they were getting some responses with that. There's a research that was done, it came out about a year ago, uh, with LSD for pain management, and it was a microdose. I believe it was around 20 mics off the top of my head. Um, that had where people could submerge their arm into ice cold water for a longer period of time, which is to simulate pain response. And it was longer with people who were microdosing than not. Um, when you start looking at some of the research out there for um, suicide headaches, migraines, they're called. Um, there is some research that shows, and there's specific dosing amounts in there, and I put it into in the clinician portion in there for the amounts to really. There's doses that are known that have been able to kind of decrease and, if not completely, remove the incidence of migraines for people with some of this. If you start looking at some of the research for macro doses, you're seeing that there's some connections that have been made. The dendrites are making longer, and I mean, I think it's easy to make the next stance. If this is happening with macro doses, why wouldn't it be doing it with micro doses? It might take longer to do it because it's a less amount, but why not? Why is it not? Which makes me think also, some of the research that we were throwing out that we don't find anything. Are we asking the right questions? Are we looking at the bigger questions, or are we just looking at what we're seeing, going, okay, there's nothing here? Are we missing it completely because it might be something that's in the weeds that's there? I don't know. And I think that's where it's going to be really exciting to see. And the other big question I really want to see is, um, I'd love to see if someone did a macro dose and we saw some improvement. Will continuing with a micro dose for a little bit of time here and there keep those pathways open, keep the what's grown there to keep that going for longer, just like we see people who have a history of macro dosing psilocybin who also do meditative practices. They can get into those deeper meditative practices easier because they know where they're going, they know those pathways. Why not, if that's something we can kind of know how to navigate, how to get around? I think it makes logic that, I think we're just ahead of the research at this point. I think that's where it's exciting to see.
It's so true. I actually was like, yeah, you're right. We haven't actually been researching it that long. This is
No.
such a new, it's new and ancient at the same time, but it is
Mhm.
such a new field, and thankfully it's growing and there's more money and funding and science
Mhm.
being, people looking into this and research. But yeah, this is why we need people like you out there talking about this.
Well, and I
I
think
find
it's
it really
also
fascinating. Yeah.
Well, I think it's also
Mm.
exciting too, is if we look at antecedent evidence that's out there. Yes, it's not worth a whole heck of a lot, but when I really look at, like, with Fadiman when he was collecting the research and talking to people and their responses, I think it's important to kind of see that and kind of track that, so then we know, okay, let's look and explore this more of where it is. I mean, I was at a book signing the other week, and it was amazing because as I'm sitting there talking to this woman, she was telling me about her husband who has temporal he has some dementia issues, and when with anxiety, depression, some of the inflammation kind of tightens down on some of the blood flow, which makes dementia symptoms worse. As he's been microdosing, his cognitive ability has gotten better with it as he's been doing it, but he also has some chronic issues where he had a stroke, and he was in his 70s, I believe. He had a stroke with some right or left sided weaknesses that were going on. And as he started microdosing, he was able to start feeling his hands, feeling his arms, and feeling, outside of there. Meanwhile, he's been working with a neurologist. She was explaining, who they said, if we don't start seeing some improvements with the standard medication in a year, it's not going to come back. At the end of the year, he kind of felt desperate, started microdosing and seeing some improvements. We can't study that. That's not something we're going to be able to study. But when I'm sitting here talking to a woman and she's crying about the improvements her husband, I'm going, we're missing something here. Research isn't going to catch this.
Oh my god, I'm speechless. This actually, it's funny. I was going to ask about this because my stepfather died in 2019 of Alzheimer's,
Mhm.
and we watched him steadily, with the decline, and it was very quick. And I kept saying, I kept sending my mom these articles on this new research. I've actually met Amanda Fielding at the Beckley Foundation
Yep.
years ago, and before the Pollen book was published, I was with her, and I remember her talking about Pollen's book and this research Beckley was funding around potential for Alzheimer's and brain disorders. And of course, Amanda's famous for what she's done to her brain. But and I wonder, and this is my biggest prayer as someone who's been working with these medicines for over 30 years, that there is a breakthrough in these, like Alzheimer's, something like
Mhm.
as it affects so many people.
And there's
I'm
no treatment out
curious.
there for them. There's
Well,
there's
yeah,
nothing. There's
exactly.
nothing for medically. The medications that are out there,
Exactly.
they don't. They might slow it, but they don't
It
make any
slows it.
improvements.
Yeah.
And I
And
do,
it
and I
was
explain that.
heartbreaking.
It is. It's
Yeah.
heartbreaking to see that, and just knowing that there's nothing you can do, and you're absolutely powerless.
Well, here's my question for you, because this has come up with me. So my mom is getting older, and we watched my stepfather die, her husband, and I've started suggesting, I made her watch Fantastic Fungi sitting
Yep.
with me during Christmas. Um, and it's like, how do you get someone who's almost 80 years old who thankfully was a former hippie, but of course now is like, oh my God, I would never touch any of these things. Like, I can't believe you go to Peru and do these hallucinogenic drugs.
Yeah.
How do we start this conversation with the ultimate skeptics, or the ultimate, the people out there, like our parents that we want to help, or people suffering from, like everybody has a friend who's had, yeah, exactly. That's, I was like, can we turn this into a short video? I guess I'll have to send my mom this podcast.
I mean, really,
Yeah.
and that's kind of where I felt, spelling it out in the book was kind of like, here's the research that's out there, here's where it can be, and for someone who's last ditch have tried everything, and you're just kind of going, what the hell else is there? What else do you have to lose?
Oh, that's,
And that's
yeah,
that.
that's what we said. When you have Alzheimer's, I said, look, he's already declining. It's not going to last. What else do we have to lose at this point? Let's try something. But, I was almost going to go in and just, microdose without him knowing. But, I thought that was a little
Yep.
unethical. So,
Well, well, there was just someone that just came out. What was it? A couple of weeks ago, one of the parliament, someone in the Senate, whatever the equivalent is over in Canada, his wife was microdosing him without his knowledge, and it was like, but he was then thankful. So it's like, you know,
hmm.
so at least with these conversations, if someone's doing it, we can kind of go, okay, someone else is doing it, here's where we're at. But I think it's just kind of getting people to recognize and just looking at, leaning in on the research. And that's kind of where, I'd been asked like early on, like, how can you even be doing this and talking about these types of things with people? Um, as a nurse, and kind of my stance is, one, I would have these conversations with someone who uses heroin, like, we want to do it safely. So
Mm-hmm.
here's what we have set up for safe use, needle exchange, etc. MAT type of programs. But then, the other part of that is here's the research that's out there. Here's what we've got for the what we've seen, what we haven't seen, and the other piece when it comes to psychedelic research is the safety provided there. It's a safe for most people, and if it's safe, then you kind of like balance out the harm risk. You know, what is it that you have to lose when there's nothing else? And I have that conversation with patients now. You're already feeling like crap, like, what's worse if we start an antidepressant and kind of look at this and go as slowly, oh, okay, you know and treating them like that. I mean, the ultimate is, if they don't do it, they're going to keep getting worse, they might die. Guess what happens if they end up microdosing? It might be better. And that's kind of, or even macrodosing when it comes to that too. you know
Um,
it was fascinating in my talk, my CIS program. I was talking with Dr. Bossis, Anthony Bossis, and he was talking about how, so we're looking at, we're doing end of life research. What would you be excited at seeing? What would you kind of like to have for research? And he had said, I would love to see having end of life for parents who have a child with terminal disease, and you're not dosing the kid, you're dosing the adult. Because how often, with having a child, you want to shield them from everything that's going on, and you can be whispering behind closed doors. They know what's going on, they're having the conversation, and they're just wishing their parent was with them. Now if you if you do a macrodose session with the parent who now have coped with the loss of their child, then they can be present for their child, and they can kind of get over it. And it was just like, oh my god, that just makes sense.
This is actually a big passion of mine because I lost my father prematurely to cancer, and then my stepfather with the Alzheimer's. When I interviewed Paul Stamets a few years ago, he spoke about the end of life therapy and the organ initiative, and I was crying during our interview because I
Yeah.
actually feel very strongly about how much this affects our whole society. I mean, we've seen this even with COVID, of the level of anxiety and fear.
Mm.
And it's like, well, what if we actually started to change our relationship to death and end of life? Not saying, go get COVID and don't take it seriously, but more around like that ultimate fear, or losing someone, or dealing with a loved one, or knowing you have a terminal illness.
Mhm.
I actually just, someone I spent time with in the jungle, I just thought about the other day. She passed away, and she was out there working with these medicines to try
Mhm.
to cope with the fact that she had this terminal
Yeah.
illness. And her death was actually quite beautiful. You know,
Mhm.
someone did a GoFundMe and funded her whole, like, this big trip she wanted to take. And then, it became this ritual. And I personally think that, working in these realms of terminal illness, end of life, like the anxiety and the fear,
Yeah.
like the ultimate societal fear, is a huge area of growth. I mean, I pray that someone's doing work around this. I know there are.
I mean, I'm probably going to be, catching slack for this if it's taken out of
Mm.
context. But if you look, we hold animals at a higher standard than humans
Mhm.
because of because of, if a dog's suffering and there's nothing you can do, we euthanize them. But
Yeah.
we can't do that in America. Well, in most places, Maine finally has passed it. Oregon's got it,
Cool.
but we're starting to move in that way. Um, and it's different. Why can't we do that? Why can't we kind of approach that to making, the time better, the quality of life there, and then we can be more present in that way, as opposed to, you know death being scary, and the end of life and the palliative that we've got right now,
Mhm.
where it could be, like you said, it could be beautiful.
Yeah.
It could be present. You don't have someone on their deathbed who's saying, I'm glad I did this and this. I'm glad I wish I would have done this, or I wish I would have. Like, we can have that where the people can arrange that, and that's where the end of life research um for what's out there is people can then spend the time in quality with their family because they're not afraid of death. They're one with it because they've already experienced that death, that ego death. They don't, they've already. There's nothing scary about it because they just realize that we're just, you know s- pieces of mass in a giant rock spinning around a sun. And what else really matters? Then we're all connected.
Beautiful. I know, I'm so glad you're talking about it. And yes, it is true. We do hold our animals in much higher dignity. So I have a question for you around shifting a little bit. This idea of microdosing coaches,
Oh.
or microdosing coaching. I've had some clients. So some of my clients are, integration
Hmm.
coaches, or health and wellness coaches, or essentially life coaches, helping people find purpose, find connection, find themselves, deal with anxiety, whatever it is. And then, some of them, not all my clients, a few, bring in something like microdosing as a tool.
Yep.
And then we see people out there, like, offering these programs. What do you think of this, and what do you think of the future of integrating microdosing into things like coaching, or even, one of my former clients was doing, like, microdosing and weight loss because it
Hmm.
worked for her, microdosing in health and wellness, microdosing in parenting, microdosing in, we could go on. What are your thoughts on that?
I've seen it all too. Like you said,
Yeah.
there's a sub. I'm going to tread lightly on this.
I know.
It really, and I had put that in part of it when I talked about it a little bit in the book, was like, when you're going out for the microdose, when you have these microdosing coaches that are out there, where the hell are they coming from? Where are they coming
Mm,
from? Other than my experience of that, which is where I think it's, I'm not going to. I don't want to diminish what they've done, or what people. There's great coaches out there. There might not be great coaches out there. There's great doctors out there. There's not so great doctors out there. There's great anything out there, and not so great. Um, and I feel that, in some level, that works for some people. Um, in other levels, it can be costly for people, where they're just kind of looking for hope and they're pouring money into it. But I think there's a place for everyone. I think there's a place for people to do, as long as they stay within their lane and their expectation. Like, when someone's saying, here's how to, you know, stop your medication, stop this, stop that, there's repercussions that can come. There's discontinuation syndromes that can come, which, ultimately, if someone stops their SSRI medication too quickly, rebound anxiety, rebound depression, suicidal thoughts. Um, I know people who have, committed suicide after stopping their meds and just kind of like trying to go through it. And that's where I think that we need to be mindful of that.
mm,
Um, you know, I, I think that there's a place where people need to have someone to bounce off ideas and get thoughts out of their head. Is that a therapist? Is that a coach? Whatever it is, I think that's a great place for people. But as long as they're not giving medical advice and not selling false hope and kind of really like, well, this is what I did and this is what you need to do too. Well, we're not one size fits all. I have those conversations with patients all the time. Like, if you feel comfortable, wanting to do something with your meds, and that's maybe where the other part of that conversation is. When I talk with patients, ultimately, um, it's not like I'm dictating their care. I'm giving recommendations to them for maybe, we can go up with this medication, maybe we can add this to it, and giving them options. Ultimately, it's up to them. They can take it or leave it when it comes, and I'm talking standard medications that we're doing, because there's an informed consent there. um, and I say to patients, I'm just kind of helping you through here, and here's what I can do to help, but it's up to you. If the side effects are too much, or it's intolerable, or you're getting weight gain, we can change it. We can do this. We can kind of look at other options. um, but for someone to turn and go, well, now you need to take, another, go up another tenth of a gram on your microdose and you're going to definitely feel better. Well, what if they're not? Where's the credibility there? So it's kind of like, there's a place, there's a time, we need to kind of, look at the grand picture. And that's where I was really fortunate when Tara Lee had asked me to do the coaching program, where I was able to kind of like go in, is because she was like, I can't answer these questions. And if you're going in on, even on a going on an ayahuasca adventure, and you're going to go in and they're not looking at the medical pieces, or they're not telling you what's in the brew, there's a red flag there, right? You're like, well, I want to know what's in there. What's the other stuff that you're putting in there? I'm done. I'm scared. I want to know what I'm taking. And that's kind of where, when it comes to microdosing, I think that people should know what to expect and what to do, how to manage it, but go from that, and working with the coach and kind of looking at the big thing. So
Mm,
you know, there's a good and there's a bad,
yeah.
and look out for that. Look out for what you're doing, and being aware of it.
Yeah. No, that's a very good point. And I actually agree. And, I talk to my clients about that and, who's qualified and do your due diligence and really, feel into it, ask the right questions.
Hmm.
I just think it's interesting. Our society, it's like our society is just looking for so many of the magic pills. Like, oh, well, maybe this will fix it all. And it's like, well, it's a lot more to the story.
Yeah,
It's like you said, it's this holistic diet, sleep, everything. Now I'm
yeah.
curious, God, I could ask you, I have 10,000 questions, but um, with microdosing, have you found that the strain matters? Like there's one strain because of course you hear about the golden teachers or the peanut
Hmm.
70s, the ones that are just popular and easy to grow.
Yep.
But I'm wondering if you've found or if anyone is doing research. That would be nice to know if anyone's doing research around this strain is good for anxiety or this strain's good for creativity or this because I personally have tried. There was one strain in particular I microdosed with, and it used to actually make me cry over and
Hmm.
over and over and over out of nowhere, which,
Yeah.
my microdose, by the way, is smaller than most normal people's microdose because
Yeah.
I'm highly, highly sensitive. But I was like, why is this one making me cry? And then I moved to the other one and it's like making me super focused. And then I do a different one and it makes me feel very like connected. I've experienced different, different feelings from different strains.
I think. Well, the old adage goes, "A cube is a cube is a cube unless it's a penis envy." Um, but and that's mostly because of the strength. I mean, that's where it is. And kind of what I had mentioned, like in the book, was, if you go from one supply to another, you might have to re-challenge to figure out what your dosing is. Either
Mhm.
being where you're getting your mushrooms from, if you're not growing them themselves, or if you're going and using, if you're cutting up your own blotter acid, and doing it that way, you get a different amount. It's going to be because, theoretically a square of LSD should be 100, but it never is. It just never is. So who knows what it is? When you cut it up, you might have to re-challenge it. Um, so what I kind of said was, if you take the whole mushrooms and you dry them down and then you grind them and then get your pre-weight, once you know what your weight is, you at least know you're not getting a differentiation really from stem to caps and going from there.
Mhm.
I'd love to see the research being done from one to the other, and and people being able to kind of track it. And I think that's where the journaling kind of comes in, of what works, what doesn't work, and kind of get an idea. Um, but I think it's also, one of the challenges when it comes to plant medicine in general. uh, the challenge when it comes to like looking at legislation is, with FDA, we need to have a set standard of whatever it is, and that's where I think we're going to see the challenges with, if we were ever to see ayahuasca go. It'd have to probably end up being pharmawaska to have that consistency across the
Mhm.
board. Um, and I think that your listeners are savvy enough to know pharmawaska is the chemical piece of it. But I think that when you start looking at just the research with psilocybin right now, we need to be mindful of all the psilocybin research that's out there, that's being published, is based on the psilocin that's being lab produced, where it's the pure, versus having the other biostatin, nystatin, whatever the other ones that are inside of, and the different amounts inside the whole mushroom. And I think that's going to be exciting to see moving forward, as things happen, because there is some research I'd mentioned in there about, there was one strain, there was that had with marble burying in mice, and which is supposed to be for anxiety. It's a symptom of anxiety, and when they had it, I don't remember if it was biostatin, whichever one it was that was in there, the mice did it less when they had this one versus the other one. um, and if you kind of, I don't like to compare a lot of microdosing and psilocybin to the marijuana movement necessarily, but if you look at like the problems that we had with synthetic marijuana, being the Marinol when that was years ago, it wasn't very effective with pain management and stuff. And part of the reason was is it didn't have the CBD in it. So we start seeing the entourage effect that's going on and all the other stuff that we just don't know yet. And I think that that's one of the
Mhm.
challenge with legislation is until things get legal, we can't really get the in the weeds research that's out there, and all we can do is the antecedent evidence. So maybe the thing is, for someone, if you're microdosing, it doesn't seem right before you rule it out. Maybe trying a different strain and seeing what's out there. You might have a better result with it too, because it might just be those strains, because everyone is chemically different. I don't know how much of a difference really. Um, I have patients all the time where I have them on SSRIs, and I go from one SSRI to another one, and theoretically, why does one work than another? I don't know necessarily, because some of them, it's all basically the same. They're all increasing serotonin in the brain, or serotonin, norepinephrine, whichever the case is, but they're all basically the same. And that's where the frustration sometimes with treatment resistant depression, like, it's tough to
Mhm.
say someone's treatment resistant when we've tried three or four different antidepressants that are all basically the same type of antidepressant. None of those are working. Okay. Well, are we changing some of the lifestyle stuff that we mentioned before? Or are we even looking at different types of medication? Are we doing transmagnetics, stimulation, ketamine, things like that? Because we got to think outside the box of what else is different. I mean, when you look at depression and stuff, we don't necessarily even know what is depression exactly. Is it because also there's the markers of inflammation that are going on? Is that the gut brain biome, which is fascinating to go into? And I think that we're going to start seeing that a little bit more. And maybe that's where microdosing might help for people, because it has that anti-inflammatory effect, which is different than just the stimulation of serotonin. And maybe that's where some of it is. I'd love to see some of this research, and I think that it's early on, and I think that's where the excitement of, as we start seeing what Oregon's going to be doing in their legislation, we're going to start seeing some different stuff that's going to be out there. And as we start seeing some decriminalization that's happened, between the couple of places in Massachusetts, Colorado, stuff like that, people can actually start looking at that. Maybe we can start getting some research, IRBs to allow this research to happen and kind of really go into it. I don't know. I think it's just fascinating. I think it's gonna be exciting to see.
That's exactly it. It's like it's so exciting, it's so fascinating, it's moving so quickly. And yeah, we'll see. And I could ask you 1,000 more questions around the future. There's a lot of listeners, of course,
Yep.
myself slightly included. Sometimes I waver between the involvement of, big pharma and patenting strains and patenting plant medicines and, what the future holds in store for us. But, I am an optimist and I would like to think everything's going in a positive direction in
Hmm.
some manner. And I do believe on some level everybody's out for the good of the whole and wants to see, healing and happiness in our society.
Well, what we're
That's
doing is
that's what
not
I hope.
working. What we're
Yeah,
doing is not
something's
working.
not
We have
working.
all these medications that are out there theoretically, as we have all these other medications that are out there, all these other treatment options, we should be seeing where mental health is getting better. But it's not.
Yes.
Drug use is going up, suicide rates are going up, you know, depression's going up. We have all these modern things that keep getting better theoretically, but we're not seeing it on paper. So
Yeah.
obviously we're missing something. What's the definition of insanity? Doing the same thing over and over again, expecting different results. So at least, yes, it might not be optimal, but at least there'll be something different, and we can kind of maybe move from there, as long as we don't have places like Oregon screwing it up, maybe, where we, limits things too much, and big pharma can really mess it up potentially, and then where is it going to go? So I think that, I'm optimistic that they're going to do, and I've had some conversations with people out there, and I think that they're really being mindful of that. I just hope that it continues with that. But what we're doing now is not sustainable necessarily until these
Yeah.
things change. And
Yeah.
I ended up having conversations with legislation here about the legalization of psilocybin for different things, and I think that there's also the fallacy people have. Well, you know, once FDA starts making approval, we're going to start seeing it. Well, some of these things like whole mushrooms are not going to be, because they're a whole medicine. Ayahuasca won't be until we start looking at things differently, because there's no consistency in what's in it from one to one. Um, and you start, looking at some of the research out there. Plant medicine's not necessarily researched very well here in the U.S. What I didn't realize was, over in Germany, they actually, in the pharmacology, for pharmacists, part of their education, like 30% of it is just on plant medicine alone.
Amazing.
Yeah, it's fascinating, because I end
Uh,
up having a conversation looking at. Sometimes I recommend to patients lavender oil, which you can get as a pill for anti-anxiety, and it's sold in Germany as the brand name Selexin. And talking with Ben Malcolm again, the Spirit Pharmacist, he had published a paper on it a few years ago, and we were talking about it with the book. And I'd said, why? Like, why is this? All these studies coming out of Germany of it, and they do studies on it for the whole medicine, which then
amazing.
you really look, it is amazing, because then you're like, what
Amazing.
else is the other stuff that's there? What is getting kind of strained out or siphoned out when we're taking out just the psilocin for
Yeah.
psilocybin?
Yeah. It's amazing. It's my herbalist when I had COVID back in the winter, I was kind of feeling like the darkness, I don't really get depressed, but I felt this like weird
Mhm.
dark thing that he said was quite typical and it's a common side effect and he sent me some saffron tincture.
Yep.
And I was like, "What? I've never even heard of this saffron." And then additionally, he said saffron's actually not as expensive as it used to be because of, you know, something about the production in
Mhm.
Afghanistan and all this, he had the whole history.
Yeah.
And it was just so simple. But
Yeah.
CJ, I'll have to bring you back onto the podcast to talk more because I have 10,000
Absolutely.
questions. But I want people to hear a little bit more about, we'll link to the book. We have a link to your website in theonurse.com. What is it that you offer? Where can they find you? Are you taking, clients, patients, and what do you have coming up this year?
I'm going to be heading down to Florida. I'm going to be presenting at the American Association of Nurse Practitioners. I'm going to be doing two talks at that. One of them is going to be psychedelics and psychiatry, which I've done a few times, and I was asked to do a second one, um, the forbidden medicines. And they kind of
Ooh,
left it open to that, and I went down the rabbit hole of what is forbidden and why, and kind of went into the more of um, the what makes it forbidden, like talking. So I went into kind of looking at kratom, ayahuasca, um, some of those more lesser known or things that aren't necessarily going to be FDA approved, that aren't fast line, like looking at the fast line we're seeing with psilocybin, past all the research with LSD, MDMA, even though it's not necessarily a psychedelic. But I also went into what's exciting is potentially nitrous oxide and how it works similar to ketamine. And you never see anyone really depressed on a lot who's, you know, using tanks of nitrous. But nitrous is used in Canada and over in Britain for in ambulances pre-hospital to help with anxiety as someone's going in. Like we're if we have such an over, S-ketamine's so expensive because of the delivery system and big pharma's movement. Okay, ketamine itself is relatively cheap of getting a provider, which then is it the pump and dump, which I hate to, versus someone who's doing therapy with it.
Yeah.
But what about nitrous? What about that as an option? There's a couple of studies that are preliminary out there. It's also a GABA inhibitor, so it works similarly. Where's that going to go? So I'm going to kind of put this out to the conference to kind of get these conversations going and leaves people with some questions. But the other part was that's kind of exciting for me is when I was asked to go to this conference. It's in Florida. Um, Initially, I'm going. Yes, it's exciting, but as we're having the conversation with my wife, it was like, do I really want to go with the "Don't Say Gay" movement that's going on in Florida? And
Mm.
so I'm going to go, and I guess one of the forbidden talks in medicine is talking about, you know, the rights of others and kind of going, hey, we need to kind of look at, these big corporations that are holding these conferences. Let's not be going to places that are doing this and minimizing society and hold you accountable. So I feel like that's going to be my podium talk that's either going to go over really well and be good, or it's going to be shooting myself in the foot. And you know what? If that's the case, so be it. At least I'm going to spur some thought and people hopefully will have an improvement. So that's some big stuff that I've got going on right
Awesome.
now. I've got the CIAS program for the next year. Part of my project for that, I have to kind of come up with a big paper, which I'm hoping to write a paper on psychedelics and psychiatry, and then hopefully figure out getting that published somewhere if I'm working on that. And then down the road, I'd love to transition into doing private practice, kind of looking at this as legalization changes, either pre-integration, integration, once things get legal to actually work with the substances, even if I have to go with ketamine for the time being. I don't know, but I'm kind
Mm.
of doing that right now. Doing more of an approach for educating providers themselves, just kind of get the word out there, instead of just getting popular media that's talking about it, but actually getting in and talking at these professional conferences, just saying, here's the research, here's what out there. I'm not just making this up. Here's where to go get more information and just get the awareness that's get the word out, basically.
Yeah.
So that's really what my big thing is. And, I'd love to kind of go over some more and come up with more ideas. I just don't know. So yeah, I've got a couple things also with like psychedelics today coming up and things like that.
Yeah.
But it's I'm an educator. That's what I enjoy it. I love it. And when I can kind of get into making this as a full time type thing, I'm very hopeful once it's legal. That's the part where I can't put my license on the line, but I can
Yeah.
teach and teach and teach. So I'm glad
How
that
about
we have
yeah.
outlets like this with you to get these conversations out there.
Yeah, it's so important. I'm like, "Oh, I could do a whole podcast interview with you talking about the problem with because I actually have a lot of clients who are nurses, doctors, therapists, and then there's the license issue, and then there's their beliefs on like, but I
Yeah,
know this can help, and it's like, how do we come to terms? And it's actually come up during a lot of interviews around this idea of like the underground and how do we make this medicine and the healing more accessible, and then that's like a whole major issue. But that's why we have you out there on these podiums talking to providers. This is amazing.
I
This has
think the
been
more
so
that
good
we
talking to
talk
you.
about it, it's going to be great to get people out of the psychedelic closet and making these normalized conversations. I mean, when I started talking about this, 5 years ago, it was like Why? How can you do it? Why can you do it? Like, this is unheard of. But then when I had like Michael Pollan's book sitting on my desk, conversations were started naturally from that. So I think it's just a matter of getting these word out there and slowly changing it, and we're seeing it. We're
Yeah.
slowly I would have never thought we're where we are now already, like in popular media and having the
Yeah.
conversations with, legislation across the board and having these conversations. But I think it's coming, and it's coming quicker than we even, my head's spinning, and
Yeah.
I haven't been in the weeds of doing this like you have for as many years, but it's amazing, and it's just breakneck speeds.
Yeah. Well, you're doing great. And I'm so glad you came on and talked about this. And thank you so much for publishing your book. We
Oh,
have all your links right here, including the link to the microdose guidebook. Take a look. And especially if you're interested in really understanding microdosing, this is it. The best thing you can do is educate, listen to CJ, follow him also on social media. He's been a riot to follow. And hear him. And sometimes he chimes in my Facebook group. So, CJ, thank you so much for being here and taking the
thank
time
you, Beth.
to share all this amazing
Yes.
wisdom. I can't wait to see what's going to blow up for you and all the educating you do in the world. Thank you.
Oh, thank you for having me. I would love to come back when more's there. I mean, this is amazing. I thank you for this. Thank you.
Thank you.